much.
Okay, then you can take her back. Thank you.
Do I start now? Is everyone ready?
Yes.
Okay. Good evening, everyone. Can they see me? I'm not seeing anyone.
We're seeing you live and direct.
Okay. Okay, so my name is Amaka Didiugwu, and I'm a medical scientist, and I specialize in gender selection, fertility consultation, and reproductive physiology. So, what we'll be discussing today is fertility, the woman's fertility, and understanding your body, and practical do's and don'ts. And also, we'll also be discussing how to, take care of your own body. Before we begin, I would want everyone to, take a paper and pen and write down questions or myths or things that you've heard before that you believe in. I want you to write them down and just keep the questions for me so that at the end of the session, we can put some clarity to what you've heard before or what you've been told or what you've seen on the internet. All right. So I want this to be an interactive session. Okay. I don't know if there a way we can make it interactive so that, because I'm not seeing anyone.
Yes. Please, can everyone come on camera? Please, if you know you're on camera, wave your hand. Okay, I'm seeing some people. Sister, where's everyone? Can you come on camera so that we can be seeing you? Can you all come on camera? Thank you. If you're where you can come on camera, please do so that we can. Thank you, Sister Ginika. God bless you. Please, we need more sisters on camera so we can see everyone. Very important. This is an interactive section. We're not talking to.
Yeah.
Thank you, Sister Clara. God bless you for that. Yeah. All right. Yeah. Thank you, Sister Tife. Thank you, Sister Tife. We need your camera on so we can see the people we're literally talking to. Yeah. All right.
Exactly. Okay. So, when you hear fertility, what comes to your mind? I need to know where everyone is, or at least the majority of people in this platform. When it comes to fertility, can I know what comes to your mind? What do you think? No one is answering. Ability to bear kids. Okay, I saw someone said ability to bear kids. Okay, that's something. Any other one?
Can I speak?
Yes, you can speak.
So, from my understanding, ability to bear kids within at least 6 months of actively trying. At least within 6 months, 6 to 1 year, depends on conditions.
Okay. Any other one? Do we have something else?
Ability to be able to reproduce offspring.
Okay. But everyone believes that fertility is just about pregnancies occurring, but fertility has a lot more to do with just pregnancies. It involves your own body. It involves having healthy fallopian tubes. It involves having a balanced hormone. You have, we know what balanced hormones are, right? So yeah, you having a balanced hormone, having clear fallopian tubes, having regular cycles, having the ability to ovulate properly. That is what fertility is. So it's not tied to just having babies. It's about having an overall good health with your reproductive system. Do you understand?
Yeah.
So I'll try as much as possible to talk in a layman's language so I can carry everyone along. This is not a medical college, so I don't want to speak with medical terms and then at the end of the day, I won't be talking to anyone. Do you understand?
Yes.
Sure. So I want to carry everyone along, so I would speak as clearly as possible. So now, what affects fertility? Does anyone know or can give me any points that affects fertility?
Age.
Yes, age affects fertility. What else?
Food. Those I don't.
Eh, yeah,
I don't know.
disease, what we eat, good, food, yeah, poor lifestyle choices. Very interesting. I like this. All
Hormonal
of you
imbalance.
are good. Hormonal imbalance affects fertility. That's very good. Hormonal imbalance affects fertility. So these things play a huge role when it comes to your fertility. Now, I assume that I'm speaking to women who are within childbearing age or approaching childbearing age.
Yes. Yes.
So so these things that we just mentioned now are factors that can affect fertility. So we have, if you're trying for a baby, let's say you're about 40 or 45, the chances of conception taking place it's lower than when you compare to someone who is 30 or 25 or thereabouts. So food affects fertility. Another thing that affects fertility is your lifestyle. If you're stressed, you're always anxious, you don't rest, you don't sleep, you don't eat properly, that affects fertility. If every time you're always eating junk foods, pizza, ice cream, fried meat, you don't eat properly, or you're always overeating, that affects fertility. Another thing that affects fertility is your weight. Your weight affects fertility. Does anyone know how to calculate? Yeah, pizza. Yeah, it seems you like pizza a lot. Guinea Kachi. It seems you like pizza a lot. So yeah, pizza affects. You shouldn't be. I'm not saying you shouldn't take pizza at all. You can take pizza, but in controlled measures. At least maybe once a month or once in 2 months. But it shouldn't be what you take every other week. So your lifestyle, if you once in a quarter is fine. Yeah. So if you work, let's say you're a civil servant or you're a businesswoman, and then you close work, let's say around 10 or 11 p.m., and then you have to wake up by 4 a.m., depending on your location, especially those who stay in Lagos, depending on your location to get to the office on time, you're lacking sleep. For your body to function well, you need at least 7 to 8 hours of sleep daily for your body to function well. 7 to 8 hours of sleep. That is standard. Sister Blossom, I can see that you're gasping. It seems you don't get enough sleep. Please, it's really important. It's a very simple thing to do that will change your life positively. But people don't do that because they're always stressed. Some people stay up watching movies. You have to finish a seasonal movie and then you stay up very late at night. So you have to get at least 7 to 8 hours of sleep. And then you have to exercise. When people say exercising, they think it's about lifting 50 kg of weight every day. No, you can just climb 3 flights of stairs. You can go for walks, brisk walks. You can skip in your bedroom, in your house, in your compound. You can do that. So these are the factors that affect fertility. Okay. So do we have any questions? Any questions so far?
Do you think alcohol affects fertility?
Definitely. I was going to get to that. Alcohol, smoking, late nights, they all affect fertility because alcohol slows down your metabolism. And when you consume, nobody said you shouldn't consume alcohol at all. You can consume alcohol, but in limited quantity. You don't take alcohol every other day. You don't take alcohol every other day. So you're not supposed to smoke at all. You're not a chimney, so you're not supposed to smoke. Whether you're smoking weed, marijuana, or okay, wait. Please, can you ask that question? I couldn't read it through. What if you want to sleep and your body does what, please? Can you say the question?
What if you want to sleep, but you see yourself always waking up at night?
So maybe there's more to it. maybe the person is worried. You're worried or you are anxious about something, or your sleep pattern has been disorganized. So if your sleep pattern has been disorganized, I doubt you'll get a full dose of 7 to 8 hours of sleep. So how many um how many months or years can someone stay after childbirth to conceive again? We're going to get to that. We're going to get to that. Please just keep that question for me, or maybe we should just answer it. Well, it depends on your body and it depends on the procedure that was used to bring forth the child. So if you delivered the baby vaginally, I'm getting a lot of questions. Please, can we like type it? Can we like keep it so that when we get to the question and answer session, then we can shoot?
Send me your questions directly so we can go back to back after 30 minutes of teaching, okay? Thank you. Thank you. Please just send me your questions. Let's go back to back. I'm taking note of the questions here as well. Thank you. Please
Okay,
go
good.
ahead.
So let me finish up with the timeline for conceiving again. So if you're interested in getting pregnant again, it depends on the mode of childbirth. If you had the baby through vaginally, then you can get pregnant in about 6 months to 1 year, depending if you healed properly, because it's not just about physical healing. It's not about your stitches drying up and all of that. It's about being in a good mental space to get pregnant again, to have another baby. So if you're fine with that, you can go ahead. But if you had your baby through cesarean section, then you have to wait for at least 18 months before you can conceive again. Even though, yes, you feel, the site is healed, that's the incision site is healed. Yeah, you feel that way, but you need full recovery before you can be operated on again, because cesarean section is actually a very complicated surgery, but because a lot of people are doing it every minute doesn't take it away that it's actually very complicated. So that's that. So I believe I'm speaking to very intelligent women because of the questions I've been getting. So I wanted to ask if anyone can tell me the reproductive organs that they know, if you understand your reproductive organs.
Vagina.
Okay, yeah, that's good. We have that. We have the fallopian tubes. We have the ovaries. Yeah, the fallopian tube, good. The womb or the uterus, yes. The ovaries, good. That's very good. We have the cervix. That's very good. So we all know what they do? Do we all know their functions? What they do in our bodies?
The womb carries the child.
Yes. After conception takes place, the fetus is implanted in the uterus and it carries the baby for about between 36 to 42 weeks, depending. The uterus, oh yes, you know enough. You know enough. The uterus and the vagina, that's what you know. That's good. So now the uterus carries the baby after conception takes place. And then, but before conception takes place, the fallopian tube is a pathway. Beautiful, yes. So the fallopian tube is seen, let's say it's like a tube, it's like a bridge. Let me not use the word tube again. It's like a bridge that carries the sperm cells to the follicles. Now, the follicle is what is released from the ovary. Your ovary, a healthy ovary releases follicles every month. That is after your period, and the ovaries are released during ovulation. So the ovaries actually contain all the eggs that a woman would ever release in her lifetime. You are born with all the follicles you will ever release. We don't produce follicles like the men produce sperm cells. We're born with it. So, some people some time ago went into selling their follicles for some money. Probably they were not properly informed because they needed some quick cash and they had to sell some follicles. So in case that happens again, because it trended about 5 or 7 years ago, But in case that happens again, I want you to make informed decisions, because when the procedure is being done, nobody will tell you the amount of follicles that would be extracted. And then you'll be left with an empty ovary, leaving you stranded when you actually need a baby. So the ovaries release your follicles at the end of your periods during ovulation. So that's the work of the ovary. It stores the follicles you were born with, and then for every cycle it releases them. For some people it alternates. You have two ovaries, the left and the right. So some people it alternates between the left and the right for every month. Some people, they can hyperovulate, and then the two ovaries are releasing follicles immediately, like back to back. That's hyperovulation. It comes with painful cramps and all of that. So that is it for the ovaries. Now, let's talk about the fallopian tube. The fallopian tube is like a bridge that conveys sperm cells from the man to the follicles that has been released. So if you're trying for a baby and you've tried everything, and it's not clicking, one thing that your gynecologist will ask you to do is to get a HSG done. It's a procedure that flushes the fallopian tube so that in case there are any blockages, maybe during a miscarriage or something like that, or anything can happen. And the fallopian, it's a very tiny tube, very, very tiny. Once it's blocked, conception cannot take place. It's like if you want to get to another end of the bridge, if there's a hindrance or a blockage in the middle, you won't get to the other end. So that is what the fallopian tube does. Yes, you'll be asked to flush your fallopian tube. So that's what HSG is. So now the cervix is what connects the outer layer of your vagina into the inner layer. So the vagina and the cervix are not the same thing. People think it's the same thing, but no, they are not. So another thing that we have, okay, we've discussed the uterus, we've discussed the fallopian tubes, the ovaries, and the cervix. So do we have any questions on this particular session? Please, if you have questions, you can mention them or you can type them out.
If your fallopian tube is blocked, you still have kits with a blocked fallopian tube, because it talks about flushing it. So does flushing it, what if you don't even know your fallopian tube is blocked? Okay, yeah, you said your gynecologist will tell you. But at the end of the day, if you flush it and it's not flushing, can you still have AIDS? Is it possible? Does it mean that with a blocked fallopian tube you can't conceive?
Well, naturally, with a blocked fallopian tube, you won't be able to conceive because the sperm cells cannot get to the follicles. So it will be impossible to conceive, but miracles do happen. So at the end of the day, I've seen people conceive with blocked fallopian tubes, but it is medically impossible. Another avenue you can conceive with a blocked fallopian tube is if you get IVF done. Because IVF is done outside the body. So, of course, the follicles are fertilized outside the body. So conception can take place. But if you're asking naturally, no, it wouldn't be possible.
Okay, ma'am. What affects the quality of the follicles or the eggs? Like someone asked, what affects the quality of the follicles or the eggs?
What affects the quality is your lifestyle and then your age. Because you can't compare a 41-year-old woman's ovarian reserve to that of a 22-year-old lady. Age tells, that's why they say women have a ticking time. So as you age, your follicles reduce, the ovarian reserve reduces. And there's a test that you can use to know your ovarian reserve. It's called anti-Müllerian hormone. It's called AMH. So it's a blood test. You can go to the hospital and get the test done. It will tell you the ovarian reserves, your egg quality, and your egg quantity. So your lifestyle affects, sometimes PCOS also affects the quality and quantity of your ovarian reserve. So, any more questions? So moving forward, I want to talk about, here we're talking about, I'm trying to divide every single topic. We are dissecting everything so that we touch every single topic and everyone goes home or leaves this meeting understanding their bodies better. So, does anyone, you know how to count your menstrual cycles, right?
Hey, we have flow up.
Yes, flow up can help, but sometimes flow up is not entirely accurate, especially when you're trying for a baby. It can make mistakes concerning your ovulation window, and it works by prediction. Someone say me, I don't know. It's okay. So, okay, I use flow up. That's good. A lot of people use flow up, and I've been tracking with flow for 9 years plus. Good. Me myself, I have the flow up on my phone, but we do it minimally. Okay. Okay. So I want you to understand how to count your cycles. First of all, we need to understand the length of your cycles. Okay. It's pertinent that you understand how your cycles come about. If you have a 28-day cycle or a 25-day cycle or a 30-day or a 32-day cycle. So once you're able to count your cycles, then we can tell when ovulation would occur. So how flow up works is it gathers your previous data. For people who have been using it for years now, it gathers your information that you've shared with it previously and predicts what will happen in future. So without your previous information, flow will tell you when you would be ovulating or when you see your next period. So now, how do you count your menstrual dates? When your period starts, okay, I'm going to teach you how to count your period dates now. When your period starts, that's day 1. Okay? If your period starts today, today is day 1. The next time your period is going to start is the next day 1. So let's say your period starts today. Today is the 18th of July. And then the next time your period starts, it's maybe the 17th or 16th of August. So can someone do the calculation? Let's know what about those spots before the real period. I'll discuss that. That is one of problems that we're seeing now. So can someone tell me how many days the cycle length is? If your period started today is 18th of July, and your next period starts on the 17th of August. Can someone let us know how many days that cycle is? So first of all, if you're counting for this August cycle, you don't count 17th. If your period starts on the 17th and you're counting from the 18th of July, you're going to stop on the 16th of August because 17th of July is another day 1. Do you understand?
No.
Okay.
So you said if your period started today, right?
Yes.
Okay, so when am I supposed to start counting?
From today. Today is day 1.
Today is day 1. Then I'll count 1, 2, 3, 4, 5, 20, 22. Is it? Yeah. So when should I count my next period?
Let's say your next period is starting on the 17th of August.
Yes. Yeah. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 26.
26?
Yeah. Does it mean I have 26 days cycle?
No, that's a 30-day cycle. From July 18th to August 17th, it's a 30-day cycle. So I need everyone to understand how to count their cycles now. So I want you to count it.
days cycle.
Good. Now, you see, we've just learned how to count our period dates, right? So
From the day it started, right, to the
is day
next
one.
starting. Oh, okay.
Yes. So that is day one. Then if it starts on the 17th, then you stop on the 16th. That's the end of that cycle. The next cycle starts on the 17th of August. So that is your day one for August.
Oh, okay.
Yes.
Oh,
So that is how, yes. So that is how you count your cycles. Now, that is your period. To get a consistent cycle length, you have to count consistently for about 3 to 6 months. So you're going to count for 3 to 6 months. So you're going to record it correctly. Now, without the Flow app, you should know when your period should be starting. So you count for July, you count for August, you count for September. Those are your period dates. Now, after your periods, what is the next thing? We enter the follicular phase. The follicular phase is when your ovaries start releasing follicles. Now, when these follicles are released, what if your period is not regular? Oh, I forgot to mention that if your cycle length varies between 2 to 5 days, that is still within the normal range. So the person who asked this question, does your cycle length vary between 2 to 5 days?
I mean, what of those persons that doesn't see their period every month? Like it can come January and doesn't come February, and the next time you're seeing it is March or April.
We need to see the person's period dates. If your period started on the 30th of January, he has no business coming in February, because you remember February is a 28-day cycle. It's a 28-day month, or 29, depending. So if your period starts on the last week of January, I doubt you'll be seeing your period in February, unless it comes on the last day of February or first week of March. Do you understand? So, but if for us to confirm that your period dates are actually irregular, that means you saw your period in January, you did not see your period in February, there was no period. If it comes twice a month, it happens. I will come to this question. There was no period in February, and then the March period now started last week of March. Then we have a problem. It is okay for you to see your period twice a month. Sometimes within 12 months of the year, you can see your period like twice in 2 months. It is normal if your period starts first week of the month and then you see another one last week of the month. If you saw your period in January and the next time is in 2 months, that is irregular. I would advise you get a hormonal assay done. Hormonal assay is a blood test that would check your hormonal levels to be sure that everything is normal, because it's not okay for you to not see your periods at least monthly. You should see your periods monthly. Unless, of course, what I mentioned previously, when your period comes last week of the month and you don't see it in the next month, but it comes first week of the following month, that is normal. Okay? Do we have any more questions? So I was discussing the follicular phase. After your period comes, the next stage is the follicular phase. That is when your ovaries start releasing follicles. Follicles are eggs. We know them as eggs. We call them eggs. People that feel sharp pain during ovulation, it's very, very normal. It's cramping. It's ovulation cramps. It's very normal for you to feel ovulation cramps when you're ovulating. It's the same way it's normal for you to have menstrual pains. It's actually normal for you to have ovulation cramps. For 2 weeks, no, it's not normal for you to have ovulation cramps for 2 weeks. Your ovulation takes place between 24 to 48 hours. So for 2 weeks, it's very abnormal. It's very abnormal. Right now, a lot of women are living with PCOS. A lot of women are living with PCOS, and I would advise that if something, yes, it's okay to take drugs for cramps if it's excruciating. Because for every medication you take, it goes down to your liver. So try as much as possible to cut down on medications, especially analgesics, that's pain medications. Try as much as possible to cut down on them, because for every medication you take, it goes down to your liver. Okay? So after what kind of drugs can someone take for painful periods? When can I know your age? How old is this person who asked this question, please? The person experiencing painful periods. You can tell Sister Blossom, so she will tell us if you don't want to tell us your age. Oh, you're in your 20s. Okay. 20s. Are you 29 or 25 downwards? So give me an idea so I can answer the question properly. No answer.
Sister Peace. Okay,
that's 25. Okay, good. So this person, what about if you're in early 30s? So this person is in her mid-20s and experiencing painful menstruation, and another person is in her early 30s and experiencing painful menstruation. I would say that if it's excruciating, you can take analgesics to calm it down. And then avoid sugary substances, drinks, foods during or few days to your periods. And then also, you can use a hot water cloth or flask on your tummy. I don't mean you should burn your tummy. I mean, something warm to massage your tummy. So, the cramps that you're feeling would ease off a bit. So sorry about that. But I don't want to, categorize it as just cramps, because women feel these things and then it's categorized as normal because it's women, and women feel pain for everything. You are in your late 20s or experiencing it, but it's not almost. Notice it reduced a little after giving birth. Oh, well, yes, medically it's supposed to reduce after giving birth. Once you get married, your ovulation cramps should reduce. But like I said earlier, I wanted to mention that, we categorize a lot of cramps as it's a woman's thing and it's okay for you to feel cramps. So I would say that if it's excruciating, I would advise you go to the hospital. So we're sure it's not endometriosis. So you have to see your doctor, your gynecologist, or your endocrinologist. An endocrinologist is a person who sees through your hormonal profile and all of that. So you can go and meet them if it's excruciating. So moving on to yours is unbearable. I would advise, Sister Precious, I would advise you go to the hospital, please. And do that as soon as possible. It's important that you go to the hospital. So moving over from the follicular phase, the next stage is the ovulation phase. So after you see your periods, follicles are produced, ovulation takes place. Now, if you're not trying for a baby, or let's say you're trying for a baby, this is when you should try for a baby, in your ovulation phase. How do you identify your ovulation phase? You have to know your cycle length. Like I mentioned earlier, what flow does is it predicts when you should be ovulating. So if you have a 30-day cycle, you should be ovulating between the 14th day and the 15th evening of your cycle. That is the prediction. But what a lot of people don't know is you can be ovulating, Flo can predict that you're supposed to ovulate on the 15th. Meanwhile, your body has already ruptured the follicle on day 13. So you see, that is why you should understand your body. So let's assume that you're trying for a baby and you want to try in your ovulation window. You have your flow up, right? Your flow up helps you. You should also get the ovulation kit. The ovulation kit, or you can get a follicular tracking done. Follicular tracking is a scan that is done in the hospital. It tells us the state of your follicles, their sizes, the position, and all of that. That is what follicular tracking does. Not just a follicle. I'm just focused now on the ovulation side. Follicular tracking can tell us the and if you have problems with your kidney, your liver, or whatever, follicular tracking would detect that. So if you're trying for a baby, what I'll advise you to do is you can use your flow app. Your flow app will give you an idea of when you're supposed to be ovulating, but you need ovulation kits. If you can't afford follicular tracking, you need ovulation kits. The ovulation kit will tell you when ovulation will be taking place. So sometimes, because I've worked with a lot of women, I've realized that the flow app is not to be entirely trusted because it predicts, it doesn't know what's going on in your body. Stress or anxiety, depression, or lack of sleep can affect the time your follicles will rupture. So if you're stressed and you're supposed to ovulate today, your body can move it to 72 hours. That is when you ovulate. So it depends on your state of mind, the state of your body. You can ovulate 48 hours before flow predicted ovulation will take place. So you see, a lot of things can happen. Like I always tell my women, your body is not a robot. It's a human being. Anything can happen. Anything. You see how my face is like this? Something can start growing out from here due to hormonal imbalance. I can start growing beards or neck hairs or beards here due to hormonal imbalance. So anything can happen. So if you're trying for a baby, I would advise that you get what? You get ovulation kit, you get follicular tracking done, and you combine it with your flow app. So that is the ovulation phase. The next phase is the luteal phase. The luteal phase is when the follicles have been released and now waiting to be fertilized. Now, for people who are not trying for a baby, this phase goes through very quickly because conception did not take place. But once conception takes place, it's implanted in the uterus. And what happens? HCG starts producing. First of all, we have, okay, I don't want to speak so much English. And then the most accurate I've used to check for ovulation is ovulation kit. Good. You see my point? That is the most accurate because it tells you what exactly is happening in your body. Flow predicts. So I think we understand that better now. I hope that I've been able to convince you and not confuse you that you should use manual methods, which are more reliable.
Yeah, but we have to
instead of just using.
we have to be consistent. We have the manual method for like three months before we can read it accurately, isn't it?
Yeah. Yes. Yes. You have to be consistent. You have to count your cycles very accurately for at least 3 months before we can depend on what you've counted. So, do we know the signs of ovulation? Can anyone tell us, even if it's one sign of ovulation? Yes, good. What are the signs of ovulation that you know? Fuller breast, yes. Mood swings, yes. Serious cramps, yes. Cravings, good. Those are the signs of ovulations. So, yes, thank you very much. So, those are the signs of ovulation. Pain below the abdomen, yes. But do you know that there are people who don't experience these signs at all, at all? from their period. In fact, people they don't experience menstrual cramps, and then they go through the ovulation phase without even experiencing ovulation cramps. They don't know that they are ovulating. They don't even see mucus. Yes, they don't. I want to, if you're here, I want you to know that it is normal for you not to see any discharge when you're ovulating. It is very normal. That does not mean you're not ovulating. You are ovulating, but you're not releasing mucus. It's fine. Sometimes you could release, but you wouldn't even know because, of course, you're going to pee and it might go with the pee and you wouldn't even notice. So I want you to know that it's normal. So the signs of ovulation that I've mentioned are cravings, slippery discharge, mood swings, cravings. I've mentioned cravings, fuller breasts, tender breasts. Those are the signs. Oh, please, what was that question? I missed it.
Hey, Dr. Maka, we'll be taking questions in 10 minutes. So let's just go back to back, and then after 10 minutes, I'll just give you all the questions I have back to back. Okay.
Okay, no problem. So those are the no. I understand. I want you to understand that this is how your cycle works. This is how your body works, and it's okay if you are not seeing or feeling ovulation cramps. If you're seeing or feeling ovulation cramps, I want you to know it's normal. It's okay for you to feel pain, no matter how painful it is. It's okay for you. But if it becomes too much, please go and see your doctor. So now let's move over to the next part, which are the do's and don'ts that we should or shouldn't do as ladies. Number one on the list is I need you to know your cycle, track your periods, and notice changes. I believe that we've already discussed that. And I know that moving forward, that every lady here from today would start tracking their cycles, because if you don't track your cycles, you won't even know when something is wrong with your body. Something could be wrong, but some people, do you know that some people don't find out they're pregnant until they're 5 months gone? Because they're not tracking their cycles. I know it sounds impossible, but it is. They don't have protruding belly, so they don't even notice. They continue treating malaria until they go to the hospital and the doctor decides to get a pregnancy test done. That's when they find out they're pregnant. So track your cycles. It's to tell you a lot about your body. Number two, practice good intimate hygiene. Please wash the vulva regularly when you're bathing. Please don't use soap to wash your vagina. We don't use soap to wash the vagina, please. And don't doubt. The vagina is self-cleansing. No matter what is given to you, no matter what is sold on the internet, please don't use it on your vagina. We have a lot of rising cases of cervical cancer. Please don't use it. Don't use soap. Just use only water. Not water and salt, or just water. Don't add anything to the water. Don't add Dettol to the water. Please. So, change your sanitary pads regularly. Let's say you're seeing your periods and then you're having a heavy flow, but you feel, oh, there's no need to change your pads. Please, that is very, very wrong. Please change your pads. Don't use any feminine wash, please. Water is okay. If you have feminine wash, I need you to go and throw it in the trash can right now. It's not necessary. Water is fine. So change your pads regularly. I know as I'm mentioning this, people feel it's not important, but there are lots of people that they use one pad for one whole day. One pad for one whole day. It is very unhygienic. Please, once if you're at home and you're seeing your periods, change your pads at least twice. If you're stepping out, take at least 2 extra sets of pads and step out. If you go to pee or you're using the loo, just change your pad. Yes, people use one pad in a day. They use one pad in a day. So, and it's very, very unhygienic. So please change your pads. I usually teach my children this, but please, as ladies, when you're wiping, wipe from the front to the back. Don't wipe from the back to the front. If you wipe from back to the front, you're taking bacteria from the inner opening into your vagina, which would give you what? Infections. So please wipe from the vagina to the anus, so you don't bringing infection into the vagina. I mentioned earlier, exercise regularly. Please, whenever I mention exercise, I don't want you to think it's about lifting weights. Please run away from clothes. I see that a lot of people are doing plenty things to their vaginas. Please run away from clothes. I said water. Vagina is self-cleansing. Please run away from clothes. All these things would eventually, maybe you think it's doing nothing, but one day, a lot of people will use the statistics for further studies. So ensure you're not in that statistic, please. So for the exercise, take brisk walks. Another thing you can do is 30 minutes after eating, make sure you jump at least 300 times. Maybe you can do 3 sets. You don't need a rope. You don't need I don't mean jump rope. Just jump 100 times, 30 minutes after eating. You don't eat and sleep, please. People that eat on their beds and after eating you sleep, please, you don't do that. It's very wrong.
What about midnight eating?
It is very, very wrong. Please, if you are depending on your lifestyle, you can eat by 12 a.m. But if you're eating by 12 a.m., that means you're going to work. That means you're going to work. That means your body understands that 12 a.m. is your daytime. Then you're going to sleep around 8 a.m. till whenever. So you can eat by 12 a.m. if you're going to work. But if you're in your house and you want to eat by 12 a.m., that is very wrong. It's all shades of wrong. Okay? So please don't eat late nights. It's very wrong. Please, you should drink enough water. I know you must have seen a Poco doctor on Instagram always talking about taking 2 liters of water. It is not a joke. Thank you, Sister Blossom. Practical example. Drink lots of water. You should take at least 2 liters of water. If you don't, like me, I don't take a lot of water, but I've discovered that the way to stimulate myself to take water is maybe take dry or healthy biscuits, all these crackers that's very low in calorie. You take it, you feel thirsty. Use the opportunity to take like at least 500 mils of water or whatever, but take plenty of water, like 2 or 3 glasses of water. It would make you drink water a lot. Okay? That is what I'm saying. Take a lot of water. If you don't take water, like there are people that can just gulp 1 liter of water just like that. But for people that don't like drinking water like me, take peanuts, like maybe 2 or 3 pieces of peanuts, and then, or you can take just 1 or 2 pieces of biscuits. It will make you want to drink water. In that way, you're drinking enough water. Sorry, my AirPods fell off. I can hear you guys. Then the next on the list is sleep. I've mentioned this sleep. I don't know if I should revisit it again. Please, talking of clothes, please, I heard it can be bold. Oh, ladies. Please, what are you guys doing with clothes? Please, run away from clothes, please. I know it's natural, but you don't need it. I told you the vagina is self-cleansing. And I said don't douche, don't smoke. I've mentioned it before. I'm trying to round up. Okay. So, for you to take care of your bodies, I want you to practice all these things that we've mentioned. Okay? I want you to count your cycles regularly. I want you to take notes of your cycles. I want you to exercise. I want you to eat properly, run away from junk foods, eat whole grains, eat normal foods. Don't eat too much rice, take more of potatoes, and please try as much as possible not to add a lot of weight. So I've been told that my time is up. Okay, can I get the questions now?
Go back. Please, if you have a question, send it to me directly. Okay. She's just going to take like 5 questions and then that's it, guys. And everybody's telling me your time is too short. I don't know why they're attacking me. Their time is too short. We didn't know Dr. Amaka will be this sweet to us. So don't worry, we'll bring her back. We'll organize a special program, just us and her alone, and then we'll bring her back again. So they're just telling me the time is short. start it. We can't let you go, but we just have so much lined up. Okay, so the first question I have here is for people that don't know when they ovulate, how will they know when to try for children? How will they know how to try their cycle? Okay, but you mentioned this, right? But
Yes, I've answered that.
you
But
already
in case you had a bad network when I was talking about that, I mentioned that you can use the ovulation kit or you can go and get follicular tracking done. That will tell you when the egg of that's a follicle will rupture. So if you're actively trying for a baby, I would advise you stay on a healthy meal plan and then try 3 or 2 days before the ovulation takes place. It gives the sperm cells time to travel and meet the follicle, and then conception can take place.
Okay, so I have very quickly, she's saying, I don't have history of twins in my family. Is it possible as a woman to have twins, even when I and my husband don't have history of twins in my family?
Yes, it's very, 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 very possible. Yes, it's very possible. There are ovulatory stimulatory drugs, but you have to discuss with your gynecologist before that can be prescribed, or a pharmacist, in case you're on any kind of medication that it interacts with. But yes, it's very possible for you to have twins, even though there are no twins in the family. It's possible.
Okay. Said, when can I start family planning after having a baby? And safe, which family planning is safe? She just said, when can I start family planning after having a baby? Yeah.
I forgot to mention, I'm an advocate of no contraceptives because that is the leading cause of cancer. So I usually advise that women track their cycles. That is another importance of tracking your cycles, so you know when you're safe. But if you are hell bent on getting contraceptives, I would suggest you get the non-hormonal, the ones that has nothing to do with your hormones. In that way, they won't trigger anything that would cause problems in future.
What
But
about fertility?
please, Postinor 2 is an emergency contraceptive. You should take it like once or twice in a year. It's not what you take every month. It's not what you take every month. It has a lot of downsides. It can disrupt your cycles. It can cause weight gain. It has a lot of downsides. That is why it's called an emergency contraceptive. Yes. So, but for the person asking for contraceptive to use, you can use the non-hormonal. Please go for non-hormonal if you want to use contraceptives.
Okay.
But once you notice anything that is wrong, once your cycles change, please remove it. Remove it. And then play safe until you want to try again for a baby. But if you're done having babies, then good luck convincing your husband to get a vasectomy, or you can tie your tubes.
Okay, so I have since I bet my baby girl, I have been having hormonal imbalance. I will see my period this month and I will see it until 2 or 3 months. What should I do, please?
So how old is the baby? Did she mention the age of the baby?
About 2 to 3.
How old is the baby, please? I didn't get that.
5 years, 5 years old, 5 years old.
The baby is 5 years and she's having hormonal imbalance. I will need you to see your endocrinologist, please. So whatever hormone that is the problem will be corrected and your cycles will return back to normal.
Okay, I'll be taking this one. Sisters, please, we'll bring her back. Someone said there are different sexual positions for different genders. We've tried it twice and it worked. Was it luck or it happens? And then, yeah. Then she also asks, what can you do about sweaty private parts, especially during pregnancy? Are
For
there
the
sexual
positions,
positions?
no, they are not. That's a myth. You were just lucky that it worked for you. But that's a myth. It doesn't. Just deep penetration is enough to get you pregnant. And if the sperm cells are healthy, conception should take place. So for the sweaty private parts, it's just your hormones. It's pregnancy hormones that's causing that. And trust me, it would stop when you're done having a baby. But if it's a lot, like it soaks, there's no style. There's no style. Can you catch it, please? There's no style. So if you're having sweaty parts and it's really serious, like it soaks your dress, I would advise you get pads, sanitary pads, so it soaks the sweat and doesn't ruin your beautiful dress.
Thank you very much, Pastor.
No, Ngozi, having one ovary does not affect your ability to have babies. You would definitely have babies, a lot of babies. As long as the ovary produces viable follicles that can be fertilized, you would have babies.
Okay. Yeah. Please, you have to let her go now, please. Thank you. Thank you so much, Doctor.
You're welcome. It was a pleasure talking to all of you. And thank you for inviting me. I hope you guys have a wonderful time. So bye for now. I look forward to seeing you all again.
Yes.